Hey there, everyone. Welcome back. You are watching Insight. Right now, we are here at Stepping Up Physical Therapy and Fitness. I am here with Jared. Jared, it's a pleasure to be back here. Today, we're talking about that functional movement. When people hear that, what exactly is functional movement?
Yeah, so functional movement is any movement that you do in everyday life. So we have to sit and stand from a chair. We have to kneel down to the floor. We have to bend over to pick up a box. Functional movement is just the way you move to do those specific tasks.
Okay, so being able to just, exercise that, whether or not it's like you said, getting up out of a chair, doing some squats, or maybe just exercising those knees. You got a kind of contraption right here. What exactly is this and how does it work?
Yeah, so this is a functional movement screen kit. So what we do here is we'll take people through a 7-step movement pattern test where we can see how they move, and the movement has to be pain-free. And with this kit, we can see imbalances that the patient has, and then that gives us a starting point on how we can treat them.
Is this a long process, or does it take a long time, or how long maybe does this exercise take for someone?
No, it doesn't take that long at all. It's just 7 basic movements. It's checking both someone's mobility to do a certain movement, and then it checks their skill on how they can do the movement. So what I'm trying to look for is deficiencies in someone's movement.
Okay.
So based off of how they do the movement, I can see imbalances with that movement. And with those imbalances, that tells me on how I'm going to direct the treatment. So if they are limited with mobility, say through their shoulders or through their hips, I got to figure out how I can increase their mobility, whether or not if it's through manual techniques or stretching. Yep. So if somebody can't move, then no matter what, they can't progress with certain strengthening exercises.
When we talk about some of those strengthening exercises, can we see what are those exercises? Are we talking about squats? Are we talking about just getting up one knee at a time?
Right.
What are we kind of doing?
Yeah, so the first test is an overhead squat. Now, not everybody can do an overhead squat. For an older adult that I know is lacking shoulder mobility, I'll just have them do a squat. And then what I'm looking at is, is their trunk coming too far forward? Are their knees collapsing in? If I see those type of imbalances, then I know I got to strengthen their hips, or I got to work on their shoulder mobility, or I got to work on their certain strengthening exercises.
And things like that automatically makes me think about when you're moving boxes, when you're picking a box up, are you leaning forward? Are you hunched back? Right. So things like that, I'm sure you're kind of looking for, because like you said, these are everyday things that we do, whether or not it's getting up off the couch, picking up a box. So you look for things like that to kind of help perfect, right?
Exactly. So people don't think about how they move usually because they're in a hurry, but people need to understand that if they move properly, that can help decrease their pain or prevent excess stress going onto their tissue or their joints than what there needs to be.
Okay.
So, yep.
All right. Well, Jared, look, we appreciate you so much. We're able to kind of see what exactly this works for getting that functional mobility, that functional movement together. We appreciate you very much.
Yes, thank you. Thanks for having me.
Yeah, everyone, take a look at your screen right now. Find out more information about Stepping Up Physical Therapy and Fitness. Get on out here and be able to see if this is a test for you. We'll be right back.